Y nada, yo voy a hablar de un tema completamente diferente, es la terapia celular en Parkinson. ¿Me oís bien? Okay, I'm going to talk in English as we have an English speaker.
Thank you.
I think it's a courtesy. And so in Parkinson's disease, as you've heard before this afternoon, there is a loss of dopamine neurons, and here you have an example of the loss of these melanized neurons in an area, and here in a microphotography. And also there is the presence of these alpha-synuclein inclusions, which are called Lewy bodies. The loss of dopamine neurons results in a loss of dopamine in the striatum. And this is responsible of some of the associated changes in the basal ganglia and the motor circuitry. And this manifests as a motor syndrome, which is characterized by bradykinesia, hypokinesia, tremor, rigidity, and also some gait disturbances. And then there are some other symptoms which are not secondary to the dopamine syndrome, which are characterized by autonomic problems. And this suggests that we may need new targets, which I'm not going to cover in this presentation, because I'm going to talk about the dopamine replacement therapy. In this case, using cells, but in any case, it's going to be a replacement of the dopamine neurons. So we cannot expect that this will improve the symptoms that are not caused by the loss of dopamine neurons. And this is a common mistake, so that's why I want to make clear that this is a specific and selective dopamine replacement therapy, but using a different approach, in this case, the cells. What is the rationale? We know that the Parkinson's disease symptoms improve when we replace the dopamine, either by pharmacological means, using L-DOPA or using some agonists, for instance, and also when we use gene therapy to improve the production of dopamine in the brain. Now, this is always causing a relief of the symptoms in the patient. So we know these symptoms are caused by the loss of dopamine. So why should we go and use cells to replace the dopamine? And the rationale is that we aim to replace the regulated dopamine transmission. And this we cannot do with a drug. Because with a drug, with L-DOPA, for instance, the response is very good, but then there are associated problems which are caused because these, the levels of dopamine are not regulated by the endogenous needs. So when we use a cell, we can control the release and the reuptake depending on the levels at the synapses. And this should improve the response and the clinical function and should lead to a more normal function of the basal ganglia. So which cells can we use to do this? So there are several characteristics, and this